looking at. All of this helps, the RHC kind of offset some of its net operating loss in the hospital overall, and is just one of the many benefits of having an RHC. So to jump back over to my my income statement highlights, operating expenses totaled $1.57 million, which is in line with prior month trends as well as current year-to-date trends, and is also reflective of the increased census. And last month, if you recall, we touched on kind of what the overall impact is from that material increase in census, and we talked about the potential Medicare payable the hospital's looking at, and that in response to that possibility, we have implemented a cash reserve to offset that. So cash receipts came out to $1.9 million, disbursements $1.1 million. March ended with an operating cash balance of $684,000, which comes out to the equivalent of a little over 13 days cash on hand. And the reason I bring that up is we strive to maintain it, what we call 10 days cash on hand. And that's to say if things hit the fan, so to speak, the hospital has 10 days contingency. The clinic financial statements are also in the packet. March year-to-date resulted in 414 visits, which comes out to a little over 6.5 patients per day. Again, these are estimated financials. So operating revenues are estimated at currently $115,000, with expenses at $233,000, bring us to net loss of potentially $818,000. And that's my financial report. Do you have any questions or want me to cover any topics?
Do you have any questions? Lisa, do you have any questions? What about the clinic financials? Were we going to separate those out?
They are. They are provided as a separate estimate.
Okay.
I'm sorry, a separate report. I just wanted to clarify that these are based on, it's an estimated financial report.
Yeah.
Just due to the nature and everything. But yes, it is provided, or it should have been provided, yes.
Okay. And I really... Perfect. And then, what is our current total debt?
Current total debt. Let me jump over to the balance sheet one moment. There's the balance sheet. I don't have the full report. Oh, okay. Sorry, found it. All right. Total liabilities are almost $21 million.
And how much was our debt at? How much has Cohesive paid down our debt? Wasn't it almost $30 million prior to you taking over?
The Medicare debt specifically is what was paid down, and it got up to roughly 8 or 9 million.
Yeah.
And so that caused all of the liabilities to increase until that couldn't be paid down further, yes.
Okay.
Mm-hmm.
Okay, great. Thank you so much.
You're welcome. Me. All right. Thank
That's it?
you.
Yeah,
All
thank
right,
you.
Thank you.
Okay, can we move on to item number 13, please? Discussion and possible action in regards to total medical professional staffing agreement.
What you have there is we didn't have a column for a renew vendor. That's really what we'll be doing here. We stepped away from total for some time. The need has came up a time or two for staffing that we couldn't meet locally or with our current staffing arrangement. So we just want to get this along with us here to make sure we have the appropriate staff at all times. We've had good business relationship with them in the past and expect the same thing going forward. If you have any questions, comments, or concerns, please have them.
What does this allow you to do with regards to,
The big thing is CNAs. Sometimes we cannot find CNAs. We hired a few lately, brought some local ones on, so we're happy about that, but there are times that we really need that additional person.
so is it a situation to where, it's not like last minute, somebody calls in and they can send somebody, it's a situation where you're employing them through there?
Well, we would have an arrangement with that agency. The agency employs them, we just give them a place to work. But all liability and that sort of thing is taken care of by the agency that's providing the staff.
But it's not a situation somebody calls in sick an hour before their shift.
Oh, no, we handle that on the day-to-day. This is when we have consistent open shifts that we can't do.
I did have a question on here. It says the departments would be clinical, human resources, and patient care. What would be the benefit of a staffing human resource person or the rationale?
I think that's just general cause, because they handle some human resources stuff on their side. They maintain an employee file, and our expectations are met in that file as well. And I think that's why they put that clause.
Okay, I was just
But
curious.
no, we're not using them for a human
I
resource.
was like, there wouldn't be any benefit to a
That's a good
staffing
question.
HR person
That's a good
that I
question.
knew of.
Right.
What do we pay a CNA locally an hour? What do we offer?
I mean, that's
locally?
commensurate with experience.
Yeah.
You can probably say an average is around 15, give or take some.
Thank you.
Along the same question, what, just directly, what do we pay on average for an RN locally? And then what do we pay cohesive staffing on average for an RN? Does that make, so if we have if we have an RN who is just with Mangum Hospital, not with any staffing agency, what would the typical hourly rate be?
You might say it this way, it's probably best presented this way, the hourly rate compared to what it actually costs the organization is very comparative. The hourly rate that we pay core staff members is minus any kind of liability insurance that we have to pay, which costs more for the hospital, benefits, which cost more for the hospital. When we employ an agency person, we don't pay for all those things.
Yeah.
So it kind of washes. Between the two, I can't really speak on the staffing side of things. I don't know how much it costs from an HR perspective. We don't have anyone on from HR. Andrew, you might be able to help me with that a little bit better. On average, what does benefits cost per staff member?
So hourly rate for business resources, say roughly like 8 to 30. I think that actually goes up.
But that's not what it costs us. What does it cost the hospital to employ a core RN? If they have benefits and that's. Yeah. It's going to be very comparative.
Okay.
Is that a sufficient answer?
Yeah, no, I just was just
Okay.
generally curious as to like if an RN locally made, $50 an hour, or then what our staffing cost was to travel an RN with cohesive staffing, because that's our primary staffing agency, correct?
Correct.
Okay, and I just was curious to see, like, was this costing us
More or less.
$10 or $20 more an hour, or is there any RNs currently that are making $100 an hour on staff?
Not that I know of. If they are, I'd like to apply.
Okay, okay. Because, yeah, I was like, I need to go back to school if that's the case. So,
Yeah, this is Dennis, and I hope you can hear me now, and that you say when you walk by the other street, it's terrible. But the other thing is that, mainly, when being so well, especially with their census is been great, but it's almost, I think it's something last year. And if you're going to have any expenses, they're going to be high. You certainly want them in med-surg, because again, that's where most of our Medicare is, and most of this is reimbursed. So it's again, not a lot of difference either way, but again, most of it's reimbursed from that standpoint. So it's been a really good start to this year.
the new staffing company, like, what's our gap that we're needing to fill? Like 1 or 2 a week, or 10 positions a week, or?
Hopefully I can answer it like this as little as possible.
Yeah.
We don't have that many gaps now, but there was a time where we did. And in this situation, it would be better to employ and pay a CNA through the agency than it would be to replace that person with a licensed or a registered person. So just dollars and cents makes more sense to have this agreement set up should the need arise.
Will
And
it save
it's
us?
very short. Pardon?
Will it save us at all to like not make a CNA go overtime? Like, would it be less expensive to have your
Yeah.
CNA work 60 hours a week and pay them overtime?
It would if they were available. That depends on
Okay.
if they're available. If they're committed to 3 shifts a week or 36 hours or
Yeah.
full-time hours. Outside of that, we can lean, beg, borrow, and plead, and I've done that. But that only gets you so far. They have lives as well.
Yeah.
You know? But they've been very good about stepping up and filling in gaps. Just sometimes there's some things that they can't.
Okay.
What,
This allows us to have a backup, having a contract with another staffing agency in case police doesn't have someone that they can send, we at least have a backup staffing agency.
Great plan, C.
so
It's an option.
what created a situation where we got rid of this? You said this is something you did in the past, and now we're bringing it back. What happened?
As best as I can recall, it just kind of, since we didn't use it, I think they separated, and it was kind of termed out. We did really well for a long time not needing that. And we anticipate to do the same thing, but we have the agreement should the need arise, hopefully.
And would there be an expectation that they would terminate that agreement if we didn't use it within a certain time period? I didn't see that in
The
there.
termination clause is there. I don't see an expiration on it. It does say it's a 1-year agreement.
Right.
So maybe we went a year. I can't answer that with 100% assurance. I can tell you some of our current staff members that are providing full-time support to Cohesive have worked and came to us from Tulsa. So either working for Mangum or for Cohesive Staffing as a result of coming on to our hospital with Tulsa.
It's not a new company, it is a company that you've had, the
Right.
relationship was prior.
Well, and that was my
years back.
question, what happened that severed that relationship? And so you're just basically, it sounds like it was just severed automatically
I
because
think
we
it
didn't
turned
utilize it.
So on the auto renewal that goes on, do they notify us of a price increase, or?
They've always been very transparent about their pricing
Yeah.
in our past relations.
Okay.
And the pricing's the current pricing we're looking at.
Yes.
And they are in scheme with the same pricing, I presume, that Cohesive charges. I would have, since we don't have that to look at, you've all said that those are within the scheme of things in
Yes.
our, so.
Very good.
Well, I'd like to make a motion that we approve the new staffing for total medical personnel staffing.
I'll second.
If we could call for a vote at this time?
Mangum,
Yes.
Haskell,
Yes.
Van Brunt,
Yes.
Hopper,
Yes.
Webb,
Yes.
Thank
Okay,
you.
moving on now to item number 14, discussion and possible action to approve My Health participation agreement and quote.
Good evening, this is Chi, and I will be presenting this item. Just want to make sure you all can hear me.
Yeah, you're great now.
Thank you. So the My Health participation agreement and quote will help the hospital and clinic meet the statewide mandate. Basically, the state has recently passed a legislative bill requiring all healthcare facilities to connect to the state-designated health information exchange called My Health Access. The compliance date is July 1st. So My Health is a web-based portal that allows providers to share protected health information to improve the patient experience by making their health information available wherever and whoever that they see in their care. So there is a cost to the My Health platform for Mangum, which is $758.92 per month. This cost is for both the hospital and the clinic. The contract is for 1 year with auto renewal. In the event the hospital would like to terminate this contract, 60 days prior written notice is required. On the quote, you will notice that My Health has temporarily removed the $10,000 integration cost between My Health and the hospital's EMR system, CPSI. My Health has proposed a bill requesting the state to pay for the integration costs for all healthcare facilities in Oklahoma. The bill will not be decided until the end of the year. So if the bill does not pass, My Health will bill the hospital for the $10,000 integration cost. In addition, the CPSI implementation cost of $10,000 is waived due to Cohesive's corporate agreement with CPSI. Please let me know if you have any questions.
Where did the 7,168 units come from? What was that computed from? 7,168 units to get the price of the 758.92. I
On
don't.
page 8.
Yeah, I don't understand the units. What are the units? Is it license? There's 7,000 license or 7,000 uses or accessibility? And if we go to 8,000, do we get charged additional? What is that number?
We're looking on page 80. On the top that is highlighted in yellow, under the monthly participant fee, the base participation fee, and it follows it by rate basis, rate of 0.10588 times what Ronnie just brought up, those 7,100 some odd units. Are those logins?
And that's, I just, if we happen to have 10,000 logins, are we gonna go back and have to reimburse? I don't know what that unit base is.
Justification case.
Is that what it is?
It looks like it says rate basis. Justification. Are we reading that correct?
That is correct.
Okay. And so if, like, let's say, just so, because I'm sorry, so if our census goes up to 18, does that mean the total monthly the reoccurring monthly base fee goes up as well? And then if our census drops, does our monthly fee go down?
To answer that question, this is an approximate rate for the entire year. So this is a lock-in rate for the entire year.
So that 700 and whatever is on a monthly charge the year, or that's per month times 12? I don't know if she can hear me. So it's a monthly fee times 12. With possibly the expectation we would also maybe have a $10,000 bill come November if the legislators don't pass whatever in this term.
But it's locked in for a year, as you said, this, 758.92.
But that's a rate, correct? So whereas our rate is actually 0.10588, meaning that every login we pay 10588, and then we're averaging that out as units, right? So we're guesstimating the units as we believe this should be used this week. Is that correct?
But she's
So I have-
saying it's monthly though. That rate's a monthly, so that rate times 12.
So is this in response to the Oklahoma State Senate having privatized our Medicare system in the state of Oklahoma versus Unitary? Is this the program that we have to use in order to be a provider, and in order for us to do? Because I read under the description that it started out as a nonprofit, la-di-da, la-di-da, and then X pages later, it's all about that statewide health information Senate bill and House bill. But if they haven't passed yet, why are we approving it? Why don't we wait to see if it gets approved and then?
They have.
You know what I mean? Oh, they have, so what is that?
They've approved that.
Okay, which
What?
part has it not approved?
They haven't
yet?
approved the $10,000 reimbursement for the setup fee.
Ah, all
That
right,
is
all
what has not
right.
been
And
approved
typically,
yet.
the laws go into effect November 1st.
Right, that's
So-
why I'm asking.
Then
So at
we
the end
would
of the
then
year, we could get a
recoup.
$10,000 bill.
So the company's deferring the $10,000 to see if the government passes, the state legislature
The,
passes.
this bill,
Yeah.
our responsibility of having this product won't be officially approved till what did you say, till the calendar, the fiscal
The
year
November,
starts?
yeah.
And is this,
But it's passed already, everything is,
well, that's what I was gonna ask.
That's
If
why
it's
I'm like-
passed, does it go into effect November 1st, or is it one of those emergency laws that went into effect immediately?
Chi, do you know when it goes into effect? We have to have this by July first.
so then what is it, September?
Is that they're gonna vote to see if they will basically refund that $10,000. But the company is
Steve, can you
deferring
hear
that
us?
charge.
So we've been mandated, but they might give us relief? Is that
Yes.
what-
Yeah.
Is that
Yeah.
a catch
Basi-
22? You have to, but maybe we'll help you?
Yeah. They passed the law, figured out every hospital's gonna pay $10,000, so somebody stepped up and is trying to pass a bill to
All right.
help the hospitals.
Did she have an answer? Did they have an answer?
I'm not sure whether she can hear or not. She hasn't answered.
Chief, can you tell us when this goes into effect?
The statute?
Yes, the compliance date is July 1st, but for this agreement, if approved tonight, it goes effect tomorrow.
Thank you.
So it has to.
You're
be
welcome.
done. There's no choices. We're sort of at their mercy, whether or not the legislators are gonna supplement that $10,000 or not.
So was the My Health, is there like 10 companies out there and they're the best, or are they the only?
Didn't they privatize it? Did you have to use these that company?
That's my understanding. Okay.
I'll reluctantly make a motion to approve.
I reluctantly second that motion. I reluctantly
Yeah.
second it.
My Health.
We could reluctantly call for a vote.
Lively,
Yes.
Heisel,
Yes.
Van Zandt,
Yes.
Hopper,
Yes.
Webb.
Yes.
Okay, moving on to item number 15, discussion of possible action to approve e-clinical works, work order from My Health Access.
Yes, so for the same compliance reasons stated before, the clinic is also required to be connected to the My Health platform by July 1st. So this work order is for the clinic's electronic health system, which is eClinical Works or ECW, to be connected to My Health. There is a maintenance fee of $25 per provider per month and a one-time implementation fee of $1,500. The work order is for 1 year with auto renewal and 60 days prior written notice.
How many providers are we needing?
Currently, there are 4 providers under ECW right now, so there will be it will be $100 per month for the maintenance fee.
And the one-time 1,500.
Okay, so it's a one-time fee of $1,500,
Yeah.
and then
Pro provider.
$25 per provider.
Per month.
Okay. Is it easy to get access for a new provider like somebody? Like, let's say we gotta fill in for a provider, will they have will it be easy to get them on?
Yeah, they're,
Because can't you do that from corporate, since it's all software?
Well, these laws just want to take them to hospitals.
No, they privatize, so we pay more. So this is the add-on we need for our rural health clinic to be compliant with the same rules, regulation that the Senate of Oklahoma has stipulated, so that's it's an add-on to the previous one.
right,
Is that
because they
correct?
have ECW.
Gotcha. Gotcha. Are we done? Are we still discussing, or can we do a motion?
I'm ready.
I'll make that motion.
I'll second.
Call for a vote, please.
Lively,
Yes.
Heisel,
Yes.
Van Zandt,
Yes.
Hopper,
Yes.
Webb.
Yes.
Discussion and possible action to approve e-clinical works amendment for HISP services.
Yeah, so this is an addendum for the clinic's electronic health system, which is ECW. ECW is required to be connected to a health information services provider, or HISP, to send direct messaging to other healthcare providers. This would maximize care coordination, secure communications, and secure data. So by connecting to a HISP for direct messaging, the clinic and hospital will be meeting the Meaningful Use Program, which is regulated by CMS. The cost is $120 per year.
I'm sorry, she said the cost was what?
Yeah, the cost seems to be different than
Yeah.
what I have on my paper.
That's why I asking.
120 per year.
120 per year?
On item 17? No,
On
the wrong
16.
page. Never mind.
Okay, okay. I'm with you. I don't know how I got there, but I'm with you.
No. Right, then we're,
27.
then we're 127.
Yeah.
So it's a direct messaging system.
I'd make a motion to approve eWorks addendum for HISP services.
And I will second that.
If we could call for a vote at this time, please.
Lively,
Yes.
Heisel,
Yes.
Van Zandt,
Yes.
Hopper,
Yes.
Webb.
Yes.
Okay, moving on to item number 17, discussion and possible action to approve Oklahoma Foundation for Medical Quality, OFMQ work order.
Yeah, so this work order agreement is for an existing vendor, that's OFMQ. So from a regulatory standpoint, the hospital is required to engage a third-party vendor to review patient medical records for medical necessity and quality of care on an annual basis. So the work order provides medical case review for up to 12 cases per year, which include peer review, medical necessity, and appropriateness of services. It also addresses quality of care concerns and compliance and national standards and regulations. The cost is $350 per month, and that is $4,000 per year. And this work order does not auto-renew, so we do need to get a new work order every year.
And it's the same cost as it was last year. That was a question.
Yeah, 300.
Okay. I don't think she can hear us over here.
So it's something we have to renew every year.
It's a third party doing peer reviews, making sure we're on the up and up rather than in-house, la-di-da, to be compliant again.
Yes.
Okay, I'll do it this time. I'd like to make a motion to approve
We're gonna
Redundant.
outweigh each
Oklahoma
other.
Foundation for Medical Quality.
I will second it.
We can call for a vote, please.
Lively,
Yes.
Heisel,
Yes.
Van Zandt,
Yes.
Hopper,
Yes.
Webb.
Yes.
Okay, item number 18, new vendor, no, existing vendor, excuse me, for the Stanley Equipment Rental Agreement.
Yes, Stanley is the current vendor that provides printer equipment needs for the hospital. The current agreement with Stanley is up for renewal, and they provided a renewal proposal for our consideration. It replaces the current printers with new and updated equipment. The cost is $2,150.58 per month on a 60-month term. This cost includes supplies, service, parts, maintenance, toner, staples, and also help desk support. So last year's cost with Stanley was $2,397. So going with Stanley's renewal proposal would be approximately $247 cost savings for the hospital.
Compared to last year's rates.
That just seems crazy. I mean, I know that's what it costs, but it just seems crazy.
I know, and our IT manager brought up to me that our printers and copiers really, really needed replaced. And, so this will be replacement.
How many copiers are we talking?
A lot.
A lot.
They're listed on page 147. There's a
Yeah.
list of them, of where they're all at.
But
and
they're
what
gonna
location.
replace all of them?
They copiers and
Currently
printers,
use-
like,
Yeah, because they make all the money. These are their already their printers.
supposed to.
So there are going to be 29 new replacement printers, and then I believe I think 2 we're keeping as is, and then there's 2 new ones that they added based on the hospital's need. And all of that is for the 2,397.
Well, I'm really
I'm sorry.
upset because I'm paying half of that from a tuition. So,
Hey, we got the address for you.
They might know a guy.
Well, I was gonna say, you
I
don't,
know some
apparently
people
you don't
here.
buy enough.
yeah, apparently not, like everybody's gonna have a copy machine. Okay, wow, that's
Put a
incredible.
couple
I
So
would
we
like to
have
make-
savings.
Yes, that's huge, I'd like to make a motion, that's a great deal. I'd like to make a motion that we approve.
I will second that motion.
Lively? Yes. Heisler?
Yes.
Van Zant?
Yes.
Hopper?
Yes.
Webb?
Yes.
Sorry, moving on to item number 19, discussion of possible action to approve Philadelphia Annex Building contents liability quote.
Yes, this is an addendum to the property quote under Philadelphia that was passed last month for the hospital. The quote provides contents liability coverage for the items currently in the annex building located next to the hospital. The liability limit coverage amount is $79,090. The cost is $4 prorated premium to add contents liability coverage effective today until May 1st, which is the current expiring policy. And then there is an annual premium cost of $195 for this contents liability coverage from May 1st, 2023 to May 1st, 2024. So we do ask the board to approve the $4 prorated rate and the $195 annual premium rate.
That's probably the lowest rate I've seen on any insurance. So that is like an additional rider onto the policies we approved last month, and this is just for the content of the annex building.
That is correct.
All right. And that 79,000 is plenty to cover the equipment that we currently house within that building?
Yes, ma'am. Currently, it has computer equipment like laptops, computers, and then there's coverage for the HVAC equipment as well as washer and dryer, and then also the PT items as well.
And that is full replacement costs?
Yes.
I'll make a motion to approve.
I will second that motion.
I'd like to, we can have a vote at this time, please.
Lively? Yes. Heisler?
Yes.
Van Zant?
Yes.
Hopper?
Yes.
Webb?
Yes.
Moving on to number 20, discussion and possible action to approve CNA quote for D&O liability and EPL liability insurance table.
This is the one we asked for the additional information.
last month we provided 2 alternate quotes for D&O and EPL insurance coverage. The first one was for Allied World in the amount of $23,357. And the second quote was for CNA in the amount of $11,062. So attached is the CNA quote along with the full policy, which provides D&O and EPL coverage. This policy protects the board in the event of claims by employees, vendors, or investors related to wrongful acts. This policy also protects the hospital from employment-related claims. The premium cost for this CNA quote is $11,062. Since the last board meeting, we had discussions with our agents regarding the CNA quote. We learned that CNA is a reputable insurance company. CNA's quote for Mangum is solid. CNA does not expect any substantial increases next year unless there are changes in the risk. So our agent believes that it would be a good move to go with CNA to have some cost savings this year.
And that's the one we were actually looking at.
That was the one that, yeah.
Yeah.
So what is the highest amount per board member per instance of coverage do we have?
So right now, the D&O coverage limit is 1 million.
1 million per instance?
Yes, this is 1 million per instance.
I'd like to make a motion that we approve CNA as the insurance for the D&O liability.
I'd second that. I'm glad we waited.
Me too. We can call for a vote, please.
Lively,
Yes.
Haskell,
Yes.
Van Zant,
Yes.
Hopper,
Yes.
Webb.
Yes.
Now we can afford it if the state doesn't pay for that.
Yeah. There's where we get it from.
There you go, we just saved an insurance.
Ding, ding, ding.
We're already planning ahead.
Oh, wait, 247.
Yeah. Okay, item number 21, discussion and possible action to approve bank direct capital finance and the finance agreement.
Yes, every year the hospital finances the cyber, D&O, and general and professional liability insurance policies. This financing agreement is with Bank Direct Capital Finance for the general liability and professional liability with MedPro in the amount of $61,277. It's also for the cyber liability with Coalition in the amount of $11,427 plus fees. And then this agreement is also for the D&O and EPL with CNA that was just approved in the amount of $11,062. So the total amount of these 3 policies combined is $84,875.62. The agreement requires a down payment of $13,071.34, which leaves the total amount financed to $71,804.28. The APR for this agreement is 9.2%. It was initially 10.45%, but our agent negotiated it down to 92%. There will be 10 monthly payments in the amount of $7,486.67.
Is this normal to finance this type of situation?
I believe so. And it's what's gonna last.
So we're financing the insurance payments?
Yes, we'll be financing the cyber liability, D&O, and general professional liability insurance policies.
This is relative to cash.
And this is a method that we take every year.
We just simply don't have the cash to be able to pay it, so
The
it's,
hospital has never been in a position in the past, to pay, I mean, honestly, this is sort of in the past, it is $100,000 upfront. So by spreading it out over multiple months, it reduces that payment, more manageable, essentially.
my insurance agent lets me do it for free. It's nowhere close to this amount, but.
I wanna talk to my insurance agent, I wanna spread this out.
That's why they're charging us the 10% or the 9, because it's.
9.2 has never looked good before,
That is the cost of
but,
business.
yeah. So I saw that 10% Medicare.
Yes.
I can't make the motion, so. Does anybody else have any questions?
I'm just pondering in my head. And this is typical for most businesses, or just typical for us because we don't have the upfront?
I pay my insurance out throughout the year.
I do too. But mine's car and house insurance.
Well, I have car, professional liability.
Additionally, I mean, we're talking, it's $3,000 in interest, so that's additional cost here. To spread it out over, 10 months. Additionally, that type of interest is allowable in cost for.
Therefore,
And I
gives
pay
us
more.
principal.
So it allows us to recoup,
Yeah, you're not getting,
so it allows us to come back and recoup that cost.
Yeah,
Okay. And I mean,
because it becomes part of our.
I feel a little better about that. I'll make the motion.
Lively? Yes. High School?
Yes.
Van Zant?
yes.
Hopper? Yes. Webb?
Yes. That helped me with that, I appreciate that.
Okay, moving on to policy, item number 22. Approving credentials for Dr. Sheffield.
Okay, because there was nothing in our pack.
I have it for you.
Okay.
Does anybody wish to go into executive session to discuss this?
Can we, do you mind if can we look at it?
This is personnel. So
Right.
we don't need to.
No, I get it.
I think if we're gonna pull up somebody's personal file, I think it's free up. I think we need to go into executive session.
Okay, then I'd make the
I was
motion.
gonna say,
to go
were there
into-
changes?
Here, I'd like to second that motion.
Yeah.
If we can call for a vote.
Lively?
Yes.
High School?
yes.
Van Zant?
Yes.
Hopper? Yes. Webb?
Yes.
Do we want to step out?
Yeah. Yeah, I will make a motion to approve the amended agreement for Dr.
Item 22, Dr. Sheffield.
Sheffield.
I will second it. If we could call for a vote?
Lively?
Yes.
High School?
Yes.
Van Zant?
Yes.
Hopper?
Yes.
Webb?
Yes.
Okay, I would like to make do we have any remarks or inquiries from the governing bodies, interim CEO, city attorney, or hospital employees?
I would just ask Steve, a couple of you guys to stay back. I'd like to visit with you
I wanted to say thank you to our newest mayor for coming to our meeting.
Thank you. I'd like to make a motion that we adjourn.
I'll second.
If we could call for a vote?
Lively,
Yes.
Heisel,
Yes.
Banton,
Yes.
Hopper,
Yes.
Webb.
Yes.
We are adjourned.
Thanks.
Yes. Yes.